welcome back. The Health Minister Kwekwaji Menu has just disclosed to Parliament that some $6 million is being made available to UNICEF for the purchase of 3 essential vaccines, which are short in supply in almost all public health facilities across the country. This, of course, many health groups raised concerns about, indicating that there are dire implications for the health sector, and especially when it comes to child immunization. Speaking in Parliament a while ago, the Minister indicated that he expects and anticipates that the shortage will be dealt with in 3 weeks.
At the time when I went to the ministry, right, I was so bogged up with trying to negotiate with Govt and our donors to actually continue to give us vaccines once we started paying for the arrears. We inherited over $15.8 million equivalent in vaccines. There was shortage of vaccines, and we even had recorded close to about 358 infections in that particular year, 2016. I have statistics here. Mr. Speaker, it's a very serious, public interest issue. The assurances I will give, and I can give for the first time in the chamber here, that this will not happen again. And I will advise that you help me in my advocacy to get adequate funding for vaccines, even the health insurance budget, right? So when we meet with committee, they have always been talking about it, and even in the chamber, it has come up. So that if Parliament approves adequately for us, we always have our budget well defined, we will be able to supply. And I'll assure you that whatever challenges that happened, I don't think we are going to face these possible challenges any longer. And I'll stand here and assure the House that within the 2 weeks, 3 weeks, we will get vaccines, possibly even probably before that. Even probably before that. So I can't lay my hands on specific dates, but even probably before that, we may get the vaccines, probably even earlier than the 3 weeks that I'm talking about. Throughout the period, we made close to $6.4 million equivalent to UNICEF, who supplies us the vaccines.
I want to bring in now Dr. Elom Ochi, who's with the Advocates for Christ. They are asking authorities to speed up the exercise. Doc, thank you for your time here on The Pulse. And of course, you've listed a number of remedial measures which, when put in place, you believe will effectively tackle the recurrence of this issue, because we've never seen anything like this in a long while.
Definitely. We've never seen anything like this in a long while. And the approach of authority is worrying because just a few days ago, the same minister indicated that the vaccines will be coming in a few weeks. Just this morning or a couple of hours ago, he's also saying 2 to 3 weeks or earlier. And this is worrying because last year, July, there was also shortage of same vaccines. There were shortages of 4 vaccines, and your media house reported just last year, July, and it was covered at the presser of the minister at the Ministry of Information. So the question is, what is it that has taken us all this while? Our babies cannot wait. Our children and our relations cannot wait. The conditions and the repercussions of a vaccine shortage is very dire for us to be. We are not even certain when the supply is going to be delivered, and that is worrying.
Okay, at least the deadline is being given now, or a timeline by the minister. He says he's working with a threshold of 3 weeks. Do we have that much time?
We don't. That's why I'm saying that so we call them vaccine preventable diseases. Okay. If you get measles, polio, all of these conditions can be averted by vaccination. So, within the 3 weeks, anything can happen. On your news portal, just a week ago, 100 people have been infected already by measles. The numbers for other diseases that we don't have are yet to come. So, what are we? And the question for some of us is, we have been at this since July 2022. When was this money paid to UNICEF? And are we now waking up to the realization that there are shortages of vaccines? What is?
Okay, the president stated earlier this week during his State of the Nation address that we should, I'm paraphrasing him here, bless God because we've not lost a single individual out of this whole vaccine shortage, and that his government will deal with the matter. He's accurate on that point.
I mean, he's accurate since 2003. And you see, it's also a very big booster to our immunization program. I mean, the Ghana Health Service and the guys at EPI are doing a very fantastic program since its inception in the 70s up until now. Our vaccination coverage generally, we are doing greater than 85% for most of the vaccinations or the immunizations that we are doing. So it's been a very fantastic work that the guys are doing, and kudos to them. But this is unacceptable. Whether somebody has died or nobody has died, it is not, we cannot be, what about those who might develop various complications as far as the absence of the vaccines at this period? Who is counting those numbers? In healthcare quality, there is one critical dimension of quality, which is timeliness. Timeliness says that when you are providing care, you should provide it without delay. Now, in this your 2 weeks or your 3 weeks or your indeterminate period within which we will be receiving vaccines, I mean, the children have lost a very vital moment as far as this vaccination is concerned. So, I mean, there's virtually no, we cannot be glorifying ourselves in the mess that we have ourselves in currently.
Okay, Doc, explain the science to us, because many are wondering how come this is just reduced to the northern parts of the country, and that we're not seeing a spillover, quote unquote, into the southern parts, where, of course, would record some more cases of measles as expected. What's happening in that regard?
No, so it's the demographic region in the north. I mean, but you see, so it is also just a matter of time. It's just because of the heat and the demographic situation in the north. That probably is the reason why we are seeing what we are seeing. But it's just a matter of time. Because, I mean, I was reading on this in the US, in CDC, there's an imported measles case in the state of Kentucky. Yeah, so, and they are describing the CDC, the scientists there are saying it was imported into the region, probably from Africa. And as I read, I sarcastically solidified that probably from Ghana. Probably from Ghana, yeah. You never know. But there are various pockets of outbreaks across. But I think there's virtually no excuse. The other excuse we are making is COVID. And that is also rightly so, that in the heat of the pandemic, manufacturers shifted a lot of attention to getting COVID vaccines because of the situation.
But is that really a disruption in the supply chain, as the health minister is pointing out?
So it's a global issue and a global phenomenon. But ours is not today. Ours goes back 10 months ago. So question,
which means we've outrun.
Yes, we have virtually either gone to sleep. Okay. Pardon my bluntness, but we had virtually gone to sleep over the period, because it's 10 months, isn't it? July to March, 10 months. So the guys who were pretty serious would have put some mechanisms in place, contacted UNICEF and all the players to ensure that they get a requisite supply.
Do you suspect that there might have been a drain on the budget of the ministry, a reason for which we're seeing, priorities being shifted? Because, mind you, we pumped so much energy into purchasing or procuring COVID-19 vaccines.
So you see, again, it's priority and prioritization, isn't it? COVID didn't affect only Ghana. So what's the excuse?
Yeah, because other countries equally had the same case, but they are not.
Yes, they are not in the mess we find ourselves, where mothers go to the hospital. They are moving from they are virtually shopping from one hospital to the other. Oh, maybe a draw, many be waiting for vaccine, many be. They are just virtually shopping from one facility to the other. It's very disheartening, distressing, and all we can do is lip service, and we are not even tentative on timelines.
Right. Last week when this issue came up, and of course I hosted a number of groups, GRNMA, the Pediatric Society, I was putting up the question as to whether or not it's time we started buying or personally affording these vaccines. Is that the way to go? Because the understanding is it's been free over the year, so possibly that's why we're having a challenge funding it.
So in our statement, we indicated as part of the sustainability that we are, 66 years, we are celebrating 66 years just about 2 or 3 years ago. Should we continue to have our hands up and begging donors to support our immunization program, a very important program as that? I mean, so we recommend that, government should invest. We are excited about the National Vaccine Institute. It's very exciting, very encouraging. Maybe they should also consider including some of these vaccines so that as a country we become self-sufficient when it comes to vaccination. Otherwise, we can't be going on like that. And whether we have money or not, it's what is our priority. And as a Christian organization, we are also asking as a country, what kind of value system is guiding us, which enables us to appropriately prioritize in the midst of the scarce resource that we have? Because there should be some minimum value set so that in between this, we can say that, no, this is a priority, so let's go for this. The EPI guys have a very fantastic immunization program and plan. But
you're really surprised about what's happening.
We cannot continue like this.
Okay, Doc, let's get the latest from Parliament, and then we'll talk about the recommendations you're making. Quick Santi is our parliamentary correspondent, and quick with the assurance there by the Minister. 3 weeks, and all of this will be aware.
According to the Minister, vaccines will be ready in the next 2-3 weeks. That is the assurance he's been giving to members of Parliament. But of course, some members of Parliament, both on the minority and the majority side, are not so excited about that promise. Indeed, there are those who say that there's a very serious issue, and then as soon as practicable, Ghana must get enough vaccines for these young people who may be at some huge risk. So just gone by, I just spoke to Honorable Sebastian Sandari. He's the one who asked that question that prompted the minister to come before Parliament. He says that 3 weeks is such a long time for anxious parents to be waiting for vaccines. And so they want the minister to fast track the process. But of course, the minister was on the floor, made it clear that some of these things is completely out of his control, and there is very little he can do within that period. And so that 3-week window that he has given is quite hopeful that government will be able to get a required vaccine into the country. But there are those who are even casting doubt as to that 3 weeks timeline that the minister has been giving to Parliament, and it is yet to be seen. And there are MPs who are raising concerns that as soon as next week they'll be asking questions, they'll be piling the pressure on government because this is something that is unacceptable.
At the last count, over 100 infections as far as measles is concerned in the northern parts of the country. Do we know if there's an update or perhaps a hike in the figures now?
That question was asked to the minister. He said that he did not have the figures around him at the time. He was answering those questions. But what he could confirm was that no person has died because there is no vaccines. That was his response.
I'm just interested in the reaction to that. How are the MPs receiving that controversial statement? Of course, the president was the first to make it. Now the minister is repeating that. The fact that, well, at least we're not doing that bad because we haven't lost anyone so far.
Indeed, the response from Kwabena Kando and Dr. Sebastian Sendari, for instance, is that is mediocre. That is mediocrity. That is not celebrating the right thing, because someone dying or someone passing on is not a standard. And that indeed, if something is supposed to happen, the idea alone that there are not enough vaccines to vaccinate young people is a cause for alarm, it's a cause for concern. And that because someone has not died, it's not an excuse to say that because someone has not died, that we are not doing something better. He said that is a comparison of mediocrity, and that should not even be on the banner at all. But the minister is quick to say that we should be thankful for what we have, because it could be worse.
Okay. The 6.4 million US dollars we're talking about, has that money been released, or this is an amount being allocated from the central government?
So according to the Govt menu, this amount of money has actually been paid to UNICEF. They've actually paid that amount of money directly to them, and they're expecting that in the next 3 weeks, the money will come in, the vaccines will come in, and then these young children who need this immunization can get them. Of course, he has been at pain to explain that his ministry has been lacking budgetary allocations and releases. And so he has been asking Parliament to do something more to power the pressure on finance ministry, not only to increase the allocation, but to ensure that whatever it is that have been allocated to them is released on time. When this vaccine shortage started, the concerns that people had was that this is a monetary issue. This was a finance matter, and that the reason why Ghana was lacking vaccine is because government was not simply releasing the required amount of money to the health ministry and its allied agencies to go ahead and do these purchases. So the minister says Parliament should do more. We should put the pressure on the finance minister to release his allocations on time and also to increase their budgetary allocation. But so far, $6.4 million have been transferred to UNICEF, according to the minister. And in 3 weeks, government expects to receive some vaccines.
Okay, in the meantime, how are we dealing with the issue of those who have been affected, those who've contracted measles as a result of the failure of government to deal with this on time?
Indeed, when the minister was answering these questions, the Ghana Health Service Director General was also around, and the kind of concerns that MPs have been expressing about the severity of this issue. They say that they have an emergency response system that they've already deployed, and the expectation is that if there are persons who are facing some peculiar challenges because of the lack of vaccines, the system is primed up enough to be able to deal with some of these issues. So there's no cause for alarm, and that if there are persons who may have some complications because the vaccines have not come in yet, Ghana Health Service have some stopgap measures to be able to deal with all these things before the anticipated vaccines arrive in the country. Bless it.
Okay, Kwekwa Asante giving us the latest there from Parliament. And Dr. Ochi is still here with us. A clear case of budgetary allocation, as the minister is also pointing to.
Yeah, so I mean, you see, the whole thing goes back to the prioritization that we talked about. So some years ago, there's what we call the Abuja Declaration, where ministers of health on the continent met in Abuja to have a discussion on health care spending. And the discussion was that it was appropriate for countries in Africa to up their healthcare expenditure at least 15% of the gross domestic.
But we are nowhere near.
Yeah. So that's the prioritization. I mean, that's why I go back to the bit of values. That as a country, what do we see as most important? You see, because I mean, listening to the remarks from your colleague, it's marks of a minister who has been irresponsible, to put it bluntly, and they are passing the buck. You see, nobody wants to take full responsibility for what has happened. So we should put pressure on your colleagues in Parliament to put pressure on the finance minister. And it is, and yesterday it was the WHO DG who was saying that globally there is a vaccine shortage, and that is why we are having a shortage in Ghana. The same 2 or 3 days ago, you had tasked the National Health Insurance to have made some $70+ million to ensure allocation and purchase of vaccines. Today, you are saying which one should we take? Right. And when is the state going to take responsibility? And our young guys cannot wait.
Okay, let's talk about the remedial measures. You're making some recommendations. Even before you touch on the recommendations, how about those who are already suffering the condition? Preventing and making sure that we contain the 100 cases we have, so we don't have that going out of hand.
So that is also a concern, and I pity colleague healthcare workers in the field, because now we have 2 pandemics. They are dealing with COVID, there is Lassa fever, and now we are having pandemic of vaccine preventable conditions, 3 pandemics. And when there is allocation of motivation people sit in the cozy of their offices and share the monies amongst themselves.
It's not
and then,
an exaggeration.
It is not. I mean, some of us played very pivotal roles during the COVID pandemic. How much did we get compared to somebody sitting in a certain ministry somewhere and sharing the money? So there are 3 pandemics. And this we are grappling with is seriously avoidable. We could have prevented where we are today.
Okay. The recommendations you're making.
So the recommendations, one is that the ministry and the minister, led by the minister, should take responsibility. He should stop passing the buck, and I mean be up front. Elsewhere, people would have elsewhere where there are core values, and people are living by core value. I mean, as a Christian, let me throw in this. It says what the Bible says that these people. We only pay lip service, and our hearts are very far away from them. So our Christianity is muff. We go to church every Sunday or Friday. Even our colleague, because I'm a Christian, let me stay in my lane. We go to church every Sunday. Census says that we are 70% Christians. If there is a mess in this society where 70% are Christians, which majority of people are creating the mess?
Okay.
So he should take responsibility. Secondly, we are saying that government should prioritize healthcare because it is more in mouth than in action. So healthcare should be prioritized. We are saying Ghana Health Service, their key slogan is health is wealth, isn't it? So if health is wealth, and we are thinking of all of this economic mess that we have created and are grappling with, I mean, we should prioritize healthcare, and probably we are able to get ourselves off this mess.
Dr. Ochi, we need to go, but for parents who are listening, especially the lactating mothers who are dealing with the babies and caretakers, what alternatives would you suggest? Do we really have alternatives, or what should they be doing in the meantime? Because the timeline the minister is giving is 3 weeks. So they still have some time ahead.
And you have to add that the minister is even not sure of his 3 weeks.
Well, we hope
because he said 2 or 3 weeks.
But that's our expectation, and we're equally praying that we'll get the.
Yes, yes. So,
but for parents, what should they be considering?
So, as a Christian, for parents, I would say that one is prayer. Because I'm talking as a Christian first, yes. But secondly, is also prevention, and how they expose the babies in this period is key. You see, because they don't have to unnecessarily be exposing the kids and the babies, especially to visitors and then to the environment and etc. That I think that becomes a primary duty and a primary responsibility, where they are carrying their children to who is holding them, because the mode of infections is either contact and then so you are touching or you are breathing, and to put it in a layman's language. So it's how much they expose their babies would determine their survival at this time. And I mean, it's very we are in a very sorry state now, and we also have to be praying for our healthcare workers who will be dealing with the irresponsibility of state actors, because health facilities are going to be flooded, are going to be dealing with COVID and its complications, Lassa fever and its complications, and then measles and its complications, polio and its complications, diphtheria and tuberculosis and all their complications from newborns, children, and infants. And
we can only pray and hope.
Sure, we can only pray.
That's all we need to do for now. But we hope that in 3 weeks, of course, this will be done and dusted.
But sometimes it looks like, as a people, God created us in His image. It means that the wisdom of God is also in man. Everything God can do, we can also do. So, I mean, when we are outsourcing our responsibilities to prayer, it makes us very irresponsible. And it makes God, sometimes, I don't know how He feels about our attitude as a people. Yeah.
Of course, an expert advice there, laced with some biblical lessons for you, Dr. Ochi. Thank you for joining us. This is
Thank
the
you.
Advocates
Yeah.
for Christ.